Assalamualaikum warahmatullahi wabarakatuh. Today I'm going to talk to you about a topic which normally we use that word occasionally, and we come across that word quite a few times in our life, like, oh, I'm shopaholic, that's why I'm OCD, or I'm quite OCD about the cleaning. Actually, OCD is a disorder which is clinically diagnosed normally, and we need to take it seriously. OCD can't be just cleaning or shopping or doing all sort of things. The difference between a normal a line between OCD and a behavior or a pattern we get used to. The difference between OCD or a general behavior would be that any other behavior, like I want to clean the home because my guests are coming, I want to keep a good impression, I generally like immaculate cleaning. But then when I have OCD and I'm cleaning, then there would be an anxiety attached to it. So my anxiety would be, oh, there would be a lot of germs in the house, I might, or my children might get um, get those germs and can be affected, or they can get sick or ill. So there's underlying anxiety. When we talk about OCD, we need to remember that there is always a thinking, there is a thought process behind it, which is quite, if we say unhealthy or negative thought, so negative automatic thought. So if, for example, I want to do shopping, but not because I like shopping, or not because I am running out of something, but shopping just to keep my anxiety level low. And I might know that I'm under the debts, and my credit cards are going out of my limits, but still I'm using it. So it's almost like I'm trying to minimize the anxiety level, but it's also a very unhealthy way how we deal with it. So what we should be doing in that case, CBT, cognitive behavior therapy, is the best way to deal with it, with OCD. Normally when client comes to me, I always say, when they ask me why I'm having OCD, I ask them, when do you have OCD? So there's a very important link between when and why. So you can easily find out why answer by finding out when answer. So I have OCD whenever I am stressed out, maybe whenever the things are not in my control, and I want to keep a control on the things outside in the world or inside within me, what feelings I'm getting. So instead of doing anything else, I'm trying to control by cleaning, or doing this extra shopping, or keeping the things to myself like a hoarder or something else. So that you need to remember what is the when it's happening. And sometimes clients come to me and they say, we don't know, this can happen at any time. And then my answer would be, then to find out the trigger point, keep a diary of it, keep a note when you are having these moments. And then obviously once you will find out that, then the second point is, what is the feeling when these things happen. So maybe things are out of control in my life. So what am I feeling? My feeling would be anxious, my feeling would be frustration, my feeling would be stressed out. And what my behavior is? OCD. So there is a link between, again, an action, but before than that there is a feeling, and before than that there is a thought process. So remember that, and then obviously by reflecting on it, and by having an insight of your patterns and your behaviors, you will be able to find out the when OCD is happening, and then obviously it will hopefully overcome that thought process. um, uh, keep an eye on your OCD patterns. If you have OCD, keep an eye on the patterns of your loved ones, the people around you, if they have the OCD. But don't use this vocabulary as just for the matter of fact. Also, I've come across a very big myth around us that, oh, OCD only happens to the people who are not good, and it's kind of a sin they have done in the life, and that's why they are trying to have this super clean behavior or that kind of thing. That's completely a nonsense. OCD is a disorder that can happen to anyone, just like other so many disorders can happen to anyone. If coronavirus is going to happen to you, it's not because of your sin, it's a virus, something like that. If OCD is happening, there is something thought process. So please don't use those languages to a person who is already struggling. Look after each other, look after yourself, keep smiling, and I'll see you in next video. Take care. Bye bye.